Hi, Rep. Thank you for being here. Can you unmute yourself or do I? There we go.
Running from meeting to meeting. I'm here. Nice to
Yay. Thank you. Thank you. I appreciate it. I'm sure. I was thinking, how could a Thursday afternoon work for you? So I so appreciate
No, well, it's great because we're not in session until 1. So we're, yeah, have plenty of time.
Okay. Perfect. Perfect. Good. I'm going to give everybody a little bit more time to jump on. And then I thought I would just introduce you a little bit and just hand it over to you, and you can talk about whatever you want around what's happening at the State House. And then if we do get into any specifics around, you know, either the ADU bill or the budget or anything, I also have some slides that I can show that will help people understand more details around the bills and things. But if it just flows with questions, that'll be fine too.
Okay. Yeah, and I mostly just want to be helpful and talk about whatever people want to talk about. So I'll talk just for a minute or a couple minutes, and then questions and whatever people find.
That's great. I mean, I think people will be very interested in hearing. I mean, we're all disability advocates. Most people are parents, some are parent professionals, but we're also, you know, citizens, and we are definitely interested in hearing the work that you guys have been doing recently. You've been able to get through the work the House has been successful on, and then just any thing that you can share that's, you know, about the challenges you guys are facing will help us understand, you know, why our 27,000 letters at this point haven't budged anything, and you know, so any insight into that is great also. But we'll wait a few more.
Well, and I know you've been doing these really regularly, so I'm sure you've talked about the budget and some other challenges.
We haven't had a lot of legislators on.
Okay.
Way in the beginning, I had Rep. Cutler.
Yep.
And it was great because people right in the beginning could tell him about like what this whole quarantine was like for them, and the PPE issue was like out of control at that point, not having enough PPE. And then I had Rep. Santiago for a whole session on the crisis standards of care.
Yeah, good.
So that's kind of it. So we haven't really heard too much around you know, what's really happening up there.
I don't know if we know what's really happening, but.
If I could just interject, could we also hear about some of the successes, like maybe what's been achieved?
Yeah.
It'd be interesting to get a picture of how COVID-19 has impacted disability in Massachusetts legislatively. And I guess I know I've sort of been getting that every week, but it'll be interesting to have that put in a box and a package, if it's possible.
Yeah.
Great, thanks, Jesse. All right, we're filling up here, which is great, and I want to get going. So we don't end up going over today like I end up doing every day. I don't want to take too much of your time, but I do want to welcome you, Rep. Barber, and thank you for being here. We're super grateful to have you on Beacon Hill, representing your constituents, but the disability community. And I know people know that Rep. Barber is also our representative to the Autism Commission, our legislative representative, which is fantastic. She also leads on a couple of important pieces of legislation for us. And, you know, I love the fact that you sit on the Healthcare Finance Committee and you have background in healthcare policy, because this has been, you know, a big push for the ARC and for AFAM. But before I hand it over to you, I just wanted to acknowledge the fact that this year in April, we would have given you our Legislator of the Year Award for Advocates of Autism in Massachusetts, and we didn't get a chance to do that. So we talked about trying to surprise you today and somehow present the award. And then we said, no, we need to do a separate Zoom. We need to get you on there and get your staff, and you know,
there'll be time for that.
Hopefully we will, and we really need to celebrate that because we're really grateful for all your work. So why don't I hand it over to you? And you know, Rep. Barber really wants to make this a really open but we're hoping that she can give us a little overview now of what's been happening in her world.
Thanks, Maura. Thank you so much for having me. I'm Christine Barber. I'm the state rep for parts of Somerville and Medford, and it is my third term, and I'm really appreciative to be here. I was a healthcare advocate before I was elected, and I didn't, to be honest, have a strong background in autism or working people with developmental disabilities. And I have learned, I've met so many folks and learned so much in this work. So thanks to many of you who have helped, Maura and many other advocates, community members. I have great programs in my district for doing this work and teaching me a lot. And as Maura said, I'm also on the Autism Commission and healthcare financing, some of the health and housing committees that, of course, all of these issues are important. And I know the last few months have been particularly hard isn't the right word, but really, really challenging for people with disabilities, for families with people with disabilities. And I really appreciate your continued ability to show up and stand up, and even when things are so hard, to keep supporting the community. So thank you for being here and for continuing to do this work. I can tell, so I don't want to talk too much because I want to hear your questions and like what would be most helpful. So I'm going to do a really quick overview of some things we've done in the State House, and I can talk about the ADU housing bill. I think Maura probably wants me to talk about that. And then whatever questions, I'm very open. You can ask me anything, and I probably don't know all the answers. So as you can imagine, because it happened to all of us, our worlds were totally turned upside down by the COVID pandemic. So we, we're in the middle of a 2-year legislative session. We had lots of priorities on expanding mass health coverage for people with developmental disabilities, autism, for housing, for all of these things, for the environment, many issues. And then COVID hit and really sucked all the air out of the room, as it did for most people in the state. But for legislators, suddenly, instead of worrying about bills, we were taking dozens and dozens of calls from constituents who needed help getting unemployment or getting food for their kids, or figuring out what to do about childcare, or worried about day programs for family members. So we were suddenly responding to hundreds of constituent calls. And my staff is amazing, and we're all remote now and at home, but it was a real shift. So in the last couple months, we've been able, we're still doing some of that work, but have been able to shift to bills and starting to do some bills that are beyond COVID, which is good. So some of the things that we did, related to COVID, I'm sure this group has talked about the data collection bill, because I know it has been impactful. And, there's more to do here, but the bill about data collection and disparities in COVID treatment. As we know, congregate care living facilities have been so hard hit, but it's been so hard, as you know, to get the data about what's really going on there. And so with that bill that we passed, there's more, I know there's more to be done, but we have more information on racial, ethnic backgrounds, people with disabilities, and trying to remove some of the barriers to PPE and making sure people have the testing and protections they need, especially in the living in congregate living in group homes and assisted living in nursing homes as well. I think for all of us in the state, all of us in the legislature, we've been so struck by what happened in the nursing homes, but also in all the congregate living sites, that it's really been hard to get our arms around what to do there so that doesn't happen again, and that we really get on a better path.
Christine, I would ask right there, we were so happy to see that data bill go through, and then also to see our data getting put up weekly on the dashboard. But I've been noticing the last couple of weeks, for some reason they're going to a data point that says death rate less than 5. And so, that doesn't actually tell us how many people, if 2 people died, if 3 people died, or if no people died.
Right.
So I think it's kind of a bad way to describe the data. I don't know who we talked to about that, but the other piece about looking at, the most vulnerable populations through this data collection is looking at that intersection of disability and race as well. We're trying really hard to work with GDS and others, on getting some of that data so we can look at, what happens to someone who has both of these areas that are going to intersect and put them at further disparity. That's really, the data is just so hard to get.
Yeah. And that's been a place, especially on race and on disability, where we've pushed. We have in the legislature, we've had they usually have weekly calls with Secretary Sutters, with Mary Lou Sutters, who's heading up, the COVID effort for Baker, where we ask her lots of questions, and she does. I mean, sometimes she'll get back to us in writing because they're pretty significant pieces, but we have a pretty good communication. I would say we don't always get the answers we want. I mean, we don't always get answers, but we've been asking lots of questions. And I think that's one. I mean, we're all nervous about reopening, seeing what's happening in other states, and worried about a resurgence, and trying to figure out how to protect vulnerable populations. And this is one key part. So I can elevate that too on those calls, because I think that's a place we're not getting information on data.
Sorry.
I'll go through quickly some of the other pieces. So as I said, really we shifted to everything about coronavirus. So I was, we got rid of, there used to be a waiting period for unemployment benefits, so making it easier, although it is still challenging to get unemployment, but we tried to make it easier and quicker to get benefits, emergency funding for rental assistance and for healthcare assistance. Something that I worked hard on and I'm proud that we did was a moratorium on evictions through the emergency, and now we're trying to extend that because we know people have been unemployed and unable to pay rent, and we don't want to have a mass of evictions once we start reopening. So we're working on rental assistance and trying to help the next phase of that. We've had to do a lot of local government changes because local governments have to meet all the time, and so that we had to make a lot of law changes to help local governments keep up with all the things they do, but also not be paralyzed by not being able to meet in person. And then one that was just signed into law is about elections. As you all know, it's an important election, and so we didn't want to have some of the challenges that we've seen in other states, and we don't really do vote by mail here. So what we just passed and the governor just signed, anyone can vote by mail, so you don't have to have an excuse, so anyone can vote by mail, and you're going to get something in the mail to fill out to send back soon. And that you can also do early voting. So I think it's maybe a week. It's a few days before election day for the primary and the general election. So we're trying to cut down on crowds on election day. So I think it's a good step, and will mean more safety and access, because we want to make sure people have access to vote. So it's a really important piece.
We're really excited about that. We're going to share that information on our website. I think it's especially important for people with disabilities who, are more at risk to go out. So
right, we want people to know they have options. You don't have to worry about going out. You can make a plan and make sure you feel safe about that. So it's hard that we just passed it. Like I said, everything is in an emergency. So we're really trying to get information out. So that's good because we know it's coming up soon and people are like, what is going on? So there's a lot to do. What I've been really focused on is I do a lot of work, especially with immigrants in my community. So unemployment wasn't translated into different languages. So we worked with the Division of Unemployment and they actually did translate the online application into 6, I think we're up to 6 languages now, because places aren't open to help people. So people were just at home and not being able to apply. And we've done a lot of work on food access too, since I mean, there's been a huge push for people to go to food banks and really, while we have amazing programs, they, can't handle some of the need in our communities. So we've really pushed, we had to work with the USDA on grocery delivery for food stamps, because we want to make sure people, don't have to go to the grocery store and feel unsafe. So that did take weeks, but we got there where we are approved now. You can get delivery using your SNAP or your food stamps. And we've really worked on the meal sites for kids. So kids usually get lunches and breakfasts at school. And we work so any kid, it doesn't matter your income or where you live, can get lunch and breakfast at meal sites in the community, and work to make them safe. So just trying to do kind of the basics to keep people safe and as healthy as possible. I do a lot with the early education as well, and it's so hard it's a huge part of reopening to figure out how to get kids back into childcare, and it's really hard. So so there's a lot of things going on, and I know so we can talk about the budget if you want. I mean, the budget we have real challenges with how much revenue is coming in, and the budget is going to be a challenge. We really need the federal government to step up and help us. I did file a bill to close a corporate tax loophole to try to raise some money, because we are faced with potentially huge budget cuts. So, I mean, to be upfront about that, I'm still pushing for a bunch of line items that I specifically carry, especially on adult autism and the Turning 22 program, but it's going to be a challenge this year. So I can talk about the ADU bill, or I can take questions. What do you think I feel like
let's see, we could jump back just quick to voting, because Paula had a question about, do you know if they're extending the register to vote? Because especially with all the moves people have had to make. I don't want to say it's August 22. We did extend it. So for the primary is September 1st this year, which is a hard date. And I believe it's August 22nd, but we should double check me on that. We did extend, that's the ability to register. And if you miss that, you can also register before the general election, which is November 3rd. So we did try to extend that, right, because people have been moving and distracted. There's a lot. Absolutely. Okay, I'm just going to share my screen, Rep, so that we can look at some of the ADU stuff, or even the budget, or whatever people have questions on. There you are. Right. So just so you know, we, as I mentioned earlier, we're really going strong on our Don't Cut Us Out campaign to really try to save our day programs and services. Because
hello, can you send me this?
Yes, Jared, I definitely will. Yes, thank you.
I know 27,000 letters is amazing. So
yeah.
It's great.
So we turned towards the legislature last week, because we had just kind of gone towards the governor, and so now you should be seeing them rolling in. We get about 1,000, maybe a little less this week than 1,000. So we're really still pushing that. So anybody on the line, make sure you've gone and shared that link as much as possible, so the legislature knows. I think you might know too that we did get a retainer to get us through to July, end of July, but you know, we're in July and everyone's trying to plan going forward. So that is a super important piece, like not even addressing yet, you know, the full line of budget line items. But we could kind of shift and talk about accessory dwelling units since we have an opportunity here.
Yeah, I don't know how much this group has talked about this as a, I mean, just the idea of accessory apartments.
Yeah.
How do you guys?
So this was a big priority to the ARC and Advocates for Autism, as you know, for years.
Yeah.
So I think most people are familiar with it. It's funny though, I think a lot of people get thrown by the ADU acronym. So I feel bad I put it out there and people were asking me, what's an accessory dwelling unit? An apartment, an in-law apartment, there's so many different names for it. But you know, we also have worked really hard and run into brick walls every year with this one. So we're super happy to just have an opportunity or a chance to really get it in front of, you know, in front of the important people to make a decision now. Do you want to talk a little bit about it, Rep,
Yeah.
about how, you know, maybe we actually are at about 750 or almost 800 letters that went out to the legislature. Oh, actually, they went out directly to Chair Ferrante and Senator Lesser.
Great. Yeah, so as I'm sure people on this call know, this is even more important because of COVID and what's been happening, and as an option for housing that's desperately needed for people with disabilities, but keeping people in the community, and which is important for lots of reasons, right? I don't have to tell you guys that. So this bill, I was really proud to work with the ARC on it this session. So we've been working on it and it has moved, but then has been kind of stuck for the last couple months, and we've trying to figure out why it's stuck. And then, as I said, COVID turned everything upside down and housing got moved off to the side somewhat. But we have an opportunity now. And I think it is maybe an uphill battle, but I think there's an opportunity. So the governor filed an economic recovery bill, and he added housing in there. So he opened the door with that to kind of putting housing in part of our economic recovery, which I think is true. We need to make sure people have safe housing right now. So it's in the Committee on Economic Development and Emerging Technologies. And I'm sure Maura will connect you, but there's two chairs, Anne Margaret Ferrante, who represents Gloucester, and Eric Lesser, who is from Western Mass, and I'm not going to get his district right, but Westernish Mass. And they're the chairs of that committee, so I'm glad that you've been sending them lots of letters. So this is an opportunity to talk about the accessory apartments, and I think especially, if I'm getting, hopefully we'll get this right, Maura will correct me, the two important parts of allowing or having 2 bedrooms so people could have a caretaker live with them, and then also a trust so people could continue to live in that home and really be an owner occupier long term. So yes, you have it right here. So those are the, I think, 2 pieces that we really want to make sure get in there, because when we talk about accessory units, people think, oh yeah, mother-in-law or like a basement apartment like we have in Somerville. But it also has those parts that make it really more accessible for people with disabilities.
Do you
Did
think,
I get that right?
yeah, absolutely. That's perfect. Oh, Jessie has a question. Can you just unmute yourself, Jess?
Oh, yes, I did.
Okay.
My question about accessory dwelling units is one of the concerns I have is even if this bill were to pass, there might still be a delay, at least locally, because like, for instance, I know in Bedford where I live, our accessory dwelling unit came up for a vote like a year and a half ago. It missed a 2/3 majority, and it would have come up this March. But of course, our town meeting was actually postponed until Saturday. But the accessory dwelling unit has been postponed. No, it's a pared down town meeting. So they're only going to be voting on stuff that's absolutely essential for the town to continue its finances. But the accessory dwelling unit's been indefinitely postponed. And I'm wondering if that's happened in other towns, and that even if this bill were to pass, how is that going to affect locally actually getting accessory dwelling units voted on and built?
That's a great question. So one of the reasons we're doing this is because at the local level, there's been a lot of pushback about accessory dwellings, and a lot of local communities, I mean, I think honestly may not understand that this is not like building a huge development. This is not adding on, a giant anything. So it's, they're pretty, as you can see, they're pretty small units. But yes, there's definitely been pushback in a lot of communities. So what this bill would do is actually basically require local communities to approve these. So there could still be other local, trying to think, permitting about location and environmental rules. I'm not a zoning expert. There are some things they can look at, but you wouldn't have to jump through the same hoops at every local level that you guys have been doing for the last.
So you're saying that there wouldn't need to be a vote? That basically
I have to double check if they don't have to vote at all, or if it makes it I have to double check that. So I apologize, I don't know that. But the reason we're doing this is to get around the challenges we've had in local communities. So let me check and get back to you.
And I think some communities have been better about letting, having accessory dwelling units go up. But we just want to make sure all people who need these can have an opportunity. So,
The goal is to make sure it's not like, well, you live in Bedford, so you don't get this, but if you lived in, Burlington, you do, that it doesn't matter, but that it's for anyone to stay in their community.
And I have a process question. You had mentioned some of the things you had done, like with SNAP benefits and the moratorium on rent. Were these all bills that had to be passed, or are there other ways for the legislator to put these in action?
Yeah, it's a good question. So the the eviction moratorium, was a bill that was filed. We had a hearing and we passed actually pretty quickly for us. But the SNAP program, that was different. It's actually, SNAP is a federal program. So we had to actually request the federal government let the state do grocery delivery for SNAP. So that wasn't a bill. We actually wrote a bunch of sign-on letters and organized a bunch of, basically a campaign to push the federal government to do that and to work with the state. So there's different ways of getting some of these policy changes.
Thank you.
So yeah, so we're pushing with these two chairs, and if you think there's anything else we could do, we're going to send letters out to the entire committee. But if you think this is the best strategy, I would tell everybody to share the link that's on the ARC's page, and it's also on my page. And if we can really get 1,000 letters, these poor chairs will have to at least respond, and you'll be communicating with them as well.
Yeah, especially, usually in the House, we talk to our House colleagues, but I'm friendly with Rep. Bronte, who's the chair. So I have not heard from her yet. So I'm sure when she realizes that it's me, she'll have something to say. No, I think it's good to be sending these in. So they had a hearing, they're taking input, they're working on the bill. At some point, the bill will go to another committee probably, and of course, Maura will know. But right now, I think the chairs are the people to connect with, and especially if you have members in the Gloucester area and in,
I think it's Wilbraham,
whatever, less, you know what his area is. I'm not, the kind of Midwest Mass, yeah. I think, is his district.
Okay, that's great. We will definitely continue to work on that. The only other bill I wanted to talk about, just because you're in healthcare finance and this is also critically important to us, is our hospital training bill. So it's Rep. Garbely on the House side, and basically we worked with the Mass Hospital Association a couple years back to develop language that would create and maintain an integrated state plan to develop training and education and standards of appropriate healthcare treatment related to IDD and autism. And the reason why I feel like this is also has a greater opportunity right now is because of everything that went down with the crisis standards of care and the lack of sort of training and understanding of what people with disabilities needed in terms of accommodations, and how caregivers, parents were shut out of being there beside their loved ones when those folks may not have been able to communicate or understand anything that was going on with them. So it took a lot of advocacy efforts to get the state to begin to address some of these things. But we realized, a lot of it is on the ground that needs, training right there in the hospitals for our existing healthcare providers. So we have a huge coalition that's been working on kind of addressing this with the secretary. And so we have this lovely bill that could help us. So that's why I bring it to your attention, and we're hoping, I'm speaking actually with the coalition today to the secretary about this bill.
So I think this is a great bill, and I am, familiar. I know you guys have done a lot of work on it, and a lot of families have done a lot of work on educating staff and making sure people are well trained. So I'm definitely supportive of it, and I'm happy to do. I can talk to my colleagues in the legislature, but also, happy to do whatever I can to try to bring this up. And I think we don't know, and I'm sorry I don't have more information, if we're doing like the healthcare bills and healthcare things. Everything is so jumbled right now. It's hard to know what's coming, but any opportunity to move this forward and try to pass this, I'm definitely supportive.
Right, we want to flag it for you, and hopefully we'll have some push from, another area that gets through, but I know that there was at least an extended deadline, right? So that will help us a lot. And we're also hoping for some of our other bills, given an extended deadline in most of the committees, we'll have a shot. So we'll be back in touch, even Operation House Call and some of the other ones that we kind of, realized weren't up at this level. But I feel like this is one of those bills that has that opportunity.
Right. I see Christine has a question, Christine Hubbard, about the Autism Commission. I can't remember what, the commission is meeting soon, but I don't remember when. Our session may end July 31st, as it typically does. There are lots of rumors that we will, and some of us have been pushing to continue meeting. In an election year, we break early, but many of us are trying to push because there's lots of things to do right now and lots of people in crisis. So I don't know how long we will meet, but I think there's an Autism Commission meeting before July 31st.
Yes,
right?
it's next week.
I know we often have trouble endorsing things as a commission because of, but I'm happy to, we could try to do that and see where we get.
Yeah, Chris, I know you've been working really hard with AFAM and DDS, and we had a meeting this week. And if there's anything that you think the Autism Commission should be stepping up on in terms of PPE, maybe not financially related, but things they could prioritize, I think it'd be great to share those.
Yeah.
I think the intent is that Autism Commission meeting to sort of talk about what are the immediate priorities. So looking forward to that discussion.
Yeah, I know there's a lot going on. It's been a little frustrating that we haven't met as a commission, but I'm glad that we are. So hopefully there'll be a space there to talk about a lot of this that's been going on. And things the secretary, of course, and commissioners can do without legislative approval. But yeah, I think the budget, and there's lots of pieces that we can to push. I should say one other piece, which is we are just finishing up what's called a supplemental budget, which is a little budget that we do all the time but most of this is money we got from the federal government and the CARES Act. So there's a good amount of money, and I don't have my numbers in front of me, but going to PPE and some of the emergency health funding. And part of that push was to get PPE out, not just in hospitals, but to, to day programs, to group homes and other places that have really struggled to get the basic equipment that people need now.
That's great to hear. I noticed Chris Callahan has a question about deadlines and the extensions from the 31st to the 31st of December.
So right now, I'm sorry that I don't know, but July 31st is typically our last day of formal session. So we may come back. My guess is that we'll come back to do the budget at least, and maybe some other things in the fall, or like September. But typically our formal sessions end July 31st, but we do have session. It's just confusing because we keep meeting until December 31st, and bills that are not controversial can still pass. The thing is, because we meet and bills pass, but one member can hold up a bill and then it doesn't pass. So if you have any opposition to a bill, and one person shows up and holds it, you can't pass your bill. So we do definitely try to keep passing things all fall, but it gets harder. So I know it's a confusing way of doing things.
No, we lived and breathed that through Nikki's Law on the first session. But
right.
actually,
you have no opposition, and then you do have opposition. And,
right. Nan Leonard has a great question about the ABA coverage for adults bill.
Yeah, and this one is still in committee. I'm pretty sure it's in Ways and Means. I should have brought all my charts with me, but or my aide to remind me what's happening. I think that one's in Ways and Means, and we have pushed Ways and Means for a cost estimate because I know that's what Mass Health keeps saying, right? Is the expense is hard. I mean, to be frank, every expense is hard right now. So adding money to Mass Health budget is going to be a really challenging argument to make right now. That said, I know it's incredibly important, and especially with everything else happening right now, it's even more so. So I think we keep talking about it and keep pushing and see where we can get.
Can I ask 2 follow-up questions on that?
Sure.
So I understand it's in Ways and Means, and we had talked about maybe including to the language of the bill that it would include people with severe intellectual disability as well. Do you know if that language change has been made yet, or could we make that before the session ends?
Yeah, and I'm definitely open to that language change. The way, usually when the committee releases a bill, they make changes like that. So
okay,
they would probably do that when they release it to the floor, but I can talk to the committee and see.
Great.
Yeah, I'm definitely, I've talked with you and Maura a lot about that change, and I'm fine with it. We just didn't get it there before it went to Ways and Means.
Slowed down, yeah.
Yeah. And then you mentioned that Ways and Means is asking about, wishing we could find a cost estimate for it. Do you know where those numbers would get generated? I would think they would need to come out internally from Mass Health because they've got the numbers on how many people have self-injurious and aggressive behavior.
I think, yes, I think Mass Health could, or Mass Health and, DDS could do it. My understanding from Autism Commission meetings was that, they know how much they're spending on the under 21 under population, but I don't know that they have a good estimate or a real, I think they could get a tighter estimate on how much it would actually cost. I guess my feeling is they're kind of saying it's too much without really getting a firm idea on numbers, and then maybe thinking about, could we phase it in over time or something that would feel more doable.
I like the idea of phasing it in over time, especially if it, could start with people with more severely dangerous behaviors.
Right.
That would be a great way to do it piecemeal so that they could see how effective it is in saving money on emergency room placements, both for the individuals with disabilities and for their family members and staff who are getting hurt.
Yeah, I think that's a good way to think about it. So as we, because we've gotten so much pushback on the cost, without really knowing more about it, I think that could be like doing sort of almost like a pilot program, but starting with people with most needs. So we should keep talking about it.
I love that idea. Okay, thanks, Rep. Barber.
That would be great. And, if you need anybody to get on that, I know Nan and I would love to. There's the other piece of it, which is, all of our folks are at home and or they're, stuck in their group homes right now. And there's never been a more important time for us to have supports. And so, so that the COVID piece could sort of play into that, just like it's playing into so many other pieces of legislation.
I agree, Maura, because once the day hubs closed, people with severe behaviors lost all access to services. And had there been a separate healthcare mass covered service of ABA, that could have continued for adults in the same way that it did for the early intervention programs. And behaviorists could have still been able to get paid and for providing treatment to the people who were at home with severe behavior. So I do think there's an important COVID angle there, that it needs to be separated from day hab service delivery systems.
Yeah, that's a great point. Thank you.
Good. Okay, do we have any other questions?
Well, I'm easy to find, and Maura can provide my info. So if you guys ever have questions, call. Our phone still works. Call or email, and I'm pretty accessible. I'm pretty good at getting back to people, even right now.
You're fantastic, and Nora's great too.
Yeah, Nora's amazing, and I'm thankful for our staff who are doing tons and tons of work right now too. So reach out if as things come up, or if you guys have questions that you think of right after the call. And thank you again. I know, as I said, there's a lot, and it's been particularly hard for folks in your community. So thanks for all the advocacy that you're always doing, and I really appreciate the work. So thanks.
Oh, thank you so much for being here, and we'll definitely be in touch.
Okay.
And stay safe.
Okay, thanks, Maura. Thanks, everyone.
Okay.
Thank you.
Bye, Rep. Everybody can stay on if they want. Just wrapping up. And does anyone have any other questions about Don't Cut Us Out, or about advocacy for any of those bills? So we do have two campaigns going right now that you could jump onto, and one of them is the ADU, and the other is the Don't Cut Us Out. And as always, continue to follow the ARC US for the federal advocacy. That is so critical. Oh, I see a couple, maybe a thank you, but I don't know. Let me check. Yep, lots of thank yous for the rep. She's really wonderful. And I hope that we can pull together a really huge Zoom at some point, so we can give her award for Legislator of the Year. But all right, well, I'm going to wrap it up. Thank you, everybody. I hope you all had a good week this week, and we'll see hopefully everybody next week. Thanks.
Bye.
Bye, everybody. Thanks. I'll send it out.
Thank you. It was terrific.
Oh, thanks, Kath. Thanks, Kath.
Oops.